Hey guys, welcome back to another episode of The Last Zebra. As always, please don't forget to like, share, and subscribe. Today's guest is Dr. Stephanie Ferrell. Welcome to the show.
Thank you.
How's everything going? Thank you so much for taking the time on this lovely evening.
Oh, no problem. Thank you for having me.
Absolutely. Tell us a little bit about yourself.
So currently I am a second year, about to be a third year, Pulmonary Crit Fellow at Tulane, which is also your alum. So it's been a good ride, wild ride, but fun. It's one of those things where you say like, enjoy the journey. I think I've enjoyed all of it. So it's been good.
Where are you originally from?
So I actually am from New Orleans, sort of, right?
Oh.
I actually was born like in Lakeside Hospital off of in Metairie. But I moved to South Carolina with my mom when I was about 3 years old, and I grew up there. I went to college there and also pharmacy school there, University of South Carolina. And then I started kind of moving around a bit. And
how did you get from once you obviously you're growing up in South Carolina, and at what point of your childhood were you like, all right, I want to be a pharmacist?
So I was actually telling the story the other day to a friend. So going through high school, I had to have like an after school job to afford like my first car and those kind of things that, you know, your parents tell you to like get a job and that kind of thing. So I started working first, like delivering pizzas when I was like 15, and working in a pizza restaurant. And that, you know, I guess when you're 15 and like delivering pizzas, that's maybe probably not the safest job for your teenage daughter. So then that became like a job at a grocery store. And then eventually I found a job like a pharmacy. And before I knew it, I was like 16 and they decided I had like, the people skills to work in the back, I guess, and deal with people that have insurance problems, as we all are familiar with now. And so I started working in a pharmacy and started at the cash register. And then before I knew it, I was like counting the pills and doing the things and just quickly like escalated from there.
Which pharmacy school did you go to?
University of South Carolina.
University of South Carolina. And undergrad was?
So there was a smaller school in Columbia, South Carolina called Columbia College. When I started college, I thought I was going to do elementary ed, be an education major and do like kindergarten, first grade teacher. But I found out through like the first couple of years of college, I really liked science a lot. But I couldn't imagine being like a high school science teacher. It just sounds very much a demanding job that I don't think I would be cut out for that. But I definitely liked sciences a lot. And I was gravitating toward that. And I switched majors to biology. And then with the pharmacy stuff, it just fits. So by the time I was finishing up college, I said, you know, I might as well just go to pharmacy school because I wasn't doing anything else between the ages of like 22 and 26, except for like, I don't know, going to concerts and that kind of stuff. So
how long were you a pharmacist for?
So I graduated pharmacy school in 2008, and then I got into med school in 2015. So I spent about 7 years doing like things like a pharmacy residency. I worked in mostly hospitals during that time. Of course, like when you say you want to go to med school, it's not like, oh, I can just start tomorrow. It's kind of like a process, right? You got to get in the right application cycle. You got to do your MCAT, and if there's any prerequisites you got to take, you got to get those done. So it took like a couple of years just to get everything kind of my ducks in a row. And there was like some personal issues going on too with my family. So it just took a couple of years, but and I got rejected the first year, as we all are probably familiar with. But you know, I got there eventually. So
what was that decision like? You are a professional, a medical professional. How did you decide, you know what, I want to go to medical school?
So your last year of pharmacy school is basically rotations through various like pharmacy settings. And I didn't grow up with a doctor in the family. So what I knew of healthcare was my mom being a nurse and then me working in the back of that pharmacy. So for me, that when I started working in the hospital and doing those rotations at the end of pharmacy school, and I remember rounding with the internal medicine teams. And just how they would take a patient and not just look at the medications, they would look at like the imaging and like look at each problem and really dissect down like to the patient's like health like all of their healthcare problems. I really enjoyed it and looking at the entire puzzle that is a patient. So
we've had two pharmacists at least on the podcast, and they both provided very different perspectives of that field of pharmacy. What was your experience as a pharmacist like?
So I think for me, I when I worked first in California as a pharmacist, and I enjoyed it a good bit. I had a good time there. And I felt like there was a lot of room for me to kind of grow in that career. When I moved back south, I felt like there may be some more limitations there. And the job market was definitely different here. I wasn't able to find kind of a job that I particularly was happy with. And then I started really looking at like, how could I expand on this? And ultimately, I think the thing that was in the back of my mind was like, you just really want to go to med school. Just like do it, just like say it, do it, make it happen. And so I started like studying for the MCAT, and then that was pretty much it. I mean, I think I always knew like after I did that first couple of rotations, I wanted to do it. So
what kind of pharmacist were you? Retail or?
So I actually was like trained to be like a clinical pharmacist. Yeah. And so I did like a pharmacy residency. I worked in kind of like a couple of roles that were more like administrative, a little bit of clinical, but like ultimately when I moved here to New Orleans, there just were no clinical spots available. They're very neat roles. And when we learn about them as doctors, we're like very much thankful for them. But at the same time, when you look at the jobs that are for pharmacists in that role as a clinical pharmacist, it's just too few and too far between. And so at the time I had to have a job. I couldn't just wait for one of those to open up. And so I took a job as like a IV room pharmacist. So I made a bunch of IVs for 2 or 3 years, which actually was pretty motivating for me to like study the MCAT. Yeah. So that's what I ended up doing before I started med school.
Did you have an idea of what kind of doctor you wanted to be?
Yeah. I mean, I really liked internal medicine a lot. I really liked I think all medicine is cerebral, so I don't mean to, bash anyone. But I definitely like the thought processes and pretty much everything, the problem solving that comes along with like internal medicine. I think too, it really relies heavily on pharmacy and pharmacology. I still loved like pharmacy in a way, like the things that you learn in pharmacy school, the mechanisms of action and the pharmacokinetics and pharmacodynamics, like all that stuff is still so really cool to me. And I'm sure you've heard people talk about like how really cool it is. I mean, I think as humans, we have like 2 ways of healing ourselves. It's either surgery or medicine. And I mean, medicine, pharmacy, that's it. And so it's still such a really cool thing to me. And so choosing internal medicine was very easy.
Did you have, or did you feel like you had a particular advantage in medical school for the pharmacology rotation?
I think
Did
so.
you even have to do it?
Yeah. Oh, yeah. You have to do all that. So like, I was this person that would, so at my medical school, went to LSU Shreveport. We learned everything in that, I guess, first and second year by like systems based, right? And so at the end of the system, like, at the beginning, you learn the embryology and how like the heart develops and, whatever, the GI tract or whatever. But at the end of it is like the medicines and the medications and all the pharmacy stuff. And that is the stuff at the end of the section when you're trying to study. Everyone's like, brain dump. No, that is going in the trash. That is not, we're not doing that. Yeah. So nobody would study the pharmacy stuff. And then I started making these like huge Excel documents with like the drugs that we had spoke about in class. And I would like highlight the things that were important to know about the drugs. Right. And so, after that, it was, people were like just expecting it,
Right. You were the go-to person.
Yeah. They were like, okay, when is Steph going to send out her Excel document on like the CNS drugs? So.
And you did your internal medicine rotation your internal medicine residency here in New Orleans.
Yes. So I worked as a pharmacist at Ochsner. And then I also did my internal medicine residency at Ochsner too. So
knowing that you loved that, the how broad internal medicine could be, why specialize? Because you're now in pulmonary critical care.
I know, but it's like, so all the drugs you could possibly want to use, I think, end up in the ICU, right?
That's
So you're using even more drugs than you could use on like the medicine floor, right? You're using all the drips, except for a few things that are in like the ORs with anesthesia, but a lot of them are in the ICU. I think that's probably why you just have more, I guess, more room to play with drugs.
I have my cousin, my very first guest on the podcast. He is interested in going back to medical school. He's been speaking about this for the past couple of years. You kind of always knew in the back of your mind that you wanted to pursue medicine, at least from the role of as with physician as your role. Was there any kind of second guessing where you're like, man,
honestly, that first semester in med school was like the scariest time. Like the hardest part of med school is getting in, I think. For me, it was. And it was just because I was so non-traditional at that point. But that first semester where I was like, okay, I basically like hid that I was going to go to med school from like most of my coworkers. Like I would study in secret and I would like get shifts where I could like study in the corner kind of thing. And so I would really kind of hide it. But, when I knew I was like getting in, I remember sitting like in the pharmacy and it was like morning announcement time or something. And they're like, anyone else got any more like news or updates? And I like raise my hand. I'm like, guys, I'm going to med school. Like 2-week notice, 2-month notice. It's happening. I got to go in August. And so, like it was an exciting time. Yeah.
Why do you feel you were shy about talking about it?
I think it's because that feeling of failure, and it was like then when I was able to tell people that I was going, it felt very good. But, as you know, there's a lot of folks that start med school and even though we all have the same dream, it just doesn't come true for some folks. And so that first semester, the whole like, do I still have like, the right study techniques? Do I have like what it takes? Am I going to be able to like memorize all the stuff? I mean, just all this stuff. But I think after that first semester, after the first like couple of tests, I like kind of got the hang of everything again. It's kind of like riding a bike,
Yeah.
And honestly, I really felt like pharmacy school was harder than med school.
Oh,
yeah, I did.
Those are
truly did.
Words.
I'm not lying. I truly like if you had to do like the calculations we had to do for pharmacy school, that was like on a whole nother level. Like doing the pharmacokinetic calculations. Oh my gosh, there's no like algebra for it.
To be fair, I will confess that the class of pharmacology. And the way it changes. I know we say medicine changes quite a bit, but pharmacy and pharmacology just literally changes by the 6 hour.
And I would challenge that statement by saying like a lot of the ways that medicine changes is because the pharmacy is driving it, right? Like the pharmacology and like the medications that we're coming out with and like there's only so many surgeries we can do on people. There's people that aren't surgical candidates. What are we going to do? And that's when we've come up with things like immunotherapy for certain cancer patients, right? Like that's totally changed the landscape of like lung cancer.
Right.
So I definitely think that a lot of it is that pharmacy world that's like pushing a lot of things in medicine.
Have you met anyone else that's taken the road that you took?
Oh man, let me tell you, I just had this experience the other day. So I walk into UMC MICU, the workroom, right? That we share with like LSU.
Yeah.
And right now we have the LSU emergency medicine like residents with us. And I'd heard years ago, like when I got in, I told everybody I was going, they're like, oh, there's this other guy over at Oshner Baptist Pharmacy and he's also applying and he got into like Tulane medicine. I'm like, oh, that's crazy. What's his name? And they're like, oh, it's John Wynn. I'm like, okay, maybe I'll run into this person one day. And so like every now and then I'd be like, anybody heard about that pharmacist that went to Tulane? And everybody would kind of give me an update every now and then, but never met the guy. So I walk into UMC MICU workroom maybe a couple weeks ago. And I was talking to one of my co-fellows and then this guy goes, Stephanie Ferrell? And I said, yes. And he was like, I'm John Wynn. And I'm like, the John Wynn? And he was like, yes. I'm like, John Wynn, PharmD, MD? He's like, yes. It was such a cool experience. And so then he actually asked me, he was like, have you gotten any other pharmacists to like do this? And I was like, dude, no, I haven't. Have you? And he's actually got a couple of people to do it.
Wow.
Yeah. And I'm like, I want that. Like, I want to be that person that encouraged someone that wanted to do it, you know?
Right.
But it's a big step. You kind of have to say like, all right, I'm going to go back to like being poor. I'm going to go back to being, you know.
Is he an ED? He's the ED resident.
Yes, he's the ED
resident. I do
resident.
know him.
Yes. Yeah.
It's wow. So he was doing a rotation at Terrebonne General.
Oh, really?
Yeah, emergency. It's all coming back to me now because I remember him coming. We were in the doctor's lounge.
I think he did his intern year in something surgical, like OB-GYN or something like that. And then he wanted to do something with like, I guess, EM. So he's doing that. But just, yeah.
Shout out to John Wynn. We have to get you on the podcast now.
But yeah, we had this like aha moment.
Yeah.
It was really, really weird that it's like you're having, I don't know, a best friend that you never met or something. So it was really cool.
How would you, if there was someone that was interested, they've been a pharmacist for the better part of, a decade, and they would like to pursue that passion of medicine and stay in healthcare, how would you encourage them to do it?
I mean, I tell people the way I did it, like I just like studied and I like paid off anything that had debt on it, like my car and my credit card. And I kind of made like a little pocket of like, a little nest egg of money so that it wouldn't feel too bad when I went back. And then I also kept my pharmacist license. So during med school, I would go and like moonlight or work extra at Ochsner on the weekends. And so it helped with that financial stuff. And also it just kind of helps when you're like in med school and you're study, if you go and like work a little bit and you remember the reason why you did it. Not to say that pharmacy is bad. There's a lot of things that like I really still love about it. And there's a lot of great people that I met through it. But I think for me, like medicine is a better fit. And I keep thinking about, do I like regret my decision to do it?
To do pharmacy or to do
medicine? Like some people are like, do you feel like you made the right choice? And I like 100% do. Like I'm still waiting for the moment where I have some like even morsel of regret about going back. And I still don't. I thought it was going to hit like maybe sometime in third year when I was taking one of the steps or like, I don't know, not even through COVID and all that mess. Like I still feel like this is just where I'm meant to be. And like, I just fit better here.
I'll flip that question. Do you regret not doing it sooner?
Not really. I thought about that too. Like, do I like feel like I regret doing pharmacy? And not really. I mean, the pharmacy stuff is really, really cool. And it did give me a way to like, earn extra money along the way. And I think at the time, University of South Carolina was like not that expensive of a PharmD, honestly. And I enjoyed it. Like I just had a great time. And like I said, I wasn't going to do anything else besides like, go to concerts and like party between the ages of 22 and 26. I needed to do something more constructive. Yeah.
So you chose Pulmonary and Critical Care, like at least 98% of all Pulm Crit because of the ICU.
Yeah.
How do you feel about pulmonary?
So, I've like thought about this and even when I was going through medical school and I was focusing on, more like MICU rotations. I knew early on in med school that I wanted to do ICU. I had a strong inclination that I wanted to do it. So I started doing like pulmonology rotations and MICU rotations and actually looked at doing, I applied to anesthesiology. Yeah. I applied to anesthesiology and internal medicine the same year because, there's a lot of drugs. There's a lot of like immediate gratification with like medications in the OR setting. Like you give some phenylephrine, that blood pressure is coming up right now. I mean, it's just so great. It's just so beautiful. Like, I mean, you give some Gammadex, they are waking up right now. Like it's so cool. Like you just see those drugs working instantaneously. It's so satisfying. But I don't get to talk to people in the OR or you shouldn't be able to talk to the patients in the OR. So I ultimately decided on internal medicine, but with that, like, and deciding to go into the MICU, the ICU side of things, I thought about doing ID for a little bit, ID critical care, but I started learning more about the like lung physiology, and I just liked it a lot. And then I also kind of started learning more about like lung transplant. And I like that a lot too, because you definitely have to have a very delicate balance of medications in every direction in that area. So.
Right. Is that what you're hoping to go into next?
Yeah. So I'm applying for lung transplant this summer.
Wow.
So, yeah. So.
Do we have a fellowship in New Orleans?
We don't have one here. There's a lot in the northern part of the country, like around Philadelphia, like Temple.
Right.
Ohio State, that area. And there's some that are more toward the southwest part of the country. So UCLA, Stanford, UCSF have some. So we'll see.
Yeah, and the pharmacotherapy and the pharmacology of lung transplant in general is, well, it's everything, because you're dealing with all of the different phases of, you're dealing with antibiotics, you're dealing with immunosuppressants, you're dealing with everything.
Exactly.
Everything.
And you really have to pay attention to like every little detail. Like, you know, the tacrolimus, like what's interacting with the tacrolimus? Like, is it causing you to have like, you know, extra potassium or low magnesium, or what is... So every little bit of it, you have to think about the drugs all the time. So
looking back now, what is an underappreciated aspect that the general public has no idea about being a pharmacist? And that physicians don't recognize about our colleagues, the pharmacists.
Oh,
now that you're a physician as well.
That's a tough one. And I would say, like, so for the physician part, just the like microcosm that is an hospital pharmacy. And if you go down there and you see like how this like machine works, that is the hospital pharmacy, and you understand like, oh, this medication has to come off the shelf. It has to be checked and barcoded and and it has to, like, it's tubed up, right? And like, I think the pneumatic tube system probably hasn't changed in like 50 years. I mean, it's the same thing that we put in banks, right? So just the entire process is just so long and arduous to process medications through the pharmacy. I think too, one thing that I had to like change my mind and my thinking on is like the idea of the sterile field, because when I worked in the ICU, when I worked in the IV room, so when I was working in the IV room, you have to like basically do like biotesting every 6 months. So I had to like dip my like fingers in agar. Like I had to clean my fingers really well, go into the IV room, dip them in agar, and prepare like IVs in a very sterile fashion with like agar and different types of agar to see that if I could contaminate what I was doing. Because if I had an unsterile process, that means I was potentially like contaminating like the IV drugs, right? That we're making, right? And so like all of the steps that we have to be sterile in the IV room are so much more. I mean, we test the air to see how many parts per million of any type of microbe. And so then when we say we're doing like a sterile line,
you chuckle at that.
This is not, none of this is sterile. None of this feels sterile. You know, it feels, you know, like, no, the door is open. Like, no, I didn't.
The AC is.
Everything. It feels so weird. So I'm like, nobody did their like, you know, fingerprint testing or anything. Like, it's very different. So I had to really change my mind and my thinking about that. Because yes, the idea of like what is truly sterile is not, is truly like whatever's in the IV bag that you see that you do not appreciate, that is sterile. So
I think about, and just today I had this conversation with a colleague of mine at work about our contact precautions that we do for MRSA. And really MRSA is the one that we're most familiar with, but MRSA, any multi-drug resistant organism, all of these ones that the patient says colonized with. But I believe the literature supports that it's the precautions aren't really doing anything.
Right.
Other than making us feel like we're doing something.
Exactly. It makes you feel like you're doing something.
Yeah.
To me, it always made me feel like I was just wasting things, you know, plastic, but no.
How is your relationship with the pharmacist where you've been, so as a resident and now as a fellow?
Oh man, I like love it. So, and it's not that, it's just because I like to talk to someone that like can think the way that I think about certain things. Like I'll be like, did we concentrate that IV enough? Or like, hey, is that renally dosed okay? Like I like to have these conversations with people. Like, can we renally dose it? But then also like, we need to adjust for BMI, like all these kind of conversations. And I feel like sometimes my colleagues would not appreciate my, I guess, neurotic thoughts about it, but the pharmacist does. So,
yeah, I went to our pharmacy, our inpatient pharmacy, for the first time last week. Yes.
Oh.
I had a patient, and I've been there 3 years. And I know the pharmacist. But you see them, they're like fairies almost, right? So pharmacists, they show up, do something, and then they disappear.
Right.
But I had a patient of mine that I wanted to start on some Yupelri, but we don't have it on the formulary. So I got some samples, started as a home medicine, and I brought the samples to the pharmacy. Well, actually, once I said that plan out loud, I went, got the samples, and the nurse had offered to bring it. And I was like, you know what, let me go find where this pharmacist is. So I walk in.
Is it in the basement?
It's not in the basement. It's on the second floor. But there are no like arrows.
There's no signs.
There's no signs.
Yeah, but because like we have fentanyl in the pharmacy. We have like the drugs you have in the pharmacy. You just have to know where they are. And it's going to be something like danger sign or something that's going to be there, like door open or something like that. And that's how you're going to know. Or there's like an RX or a medicine bottle somewhere. But like, yeah, most of the pharmacies that I've been to in the hospital, they don't necessarily designate themselves as like the inpatient pharmacy because you have like all of the fentanyls in there.
Right.
So, or all that stuff.
I remember walking out the elevator, and the way it was described to me was, you get out the elevator, there is a nondescript door.
Yep.
It won't look like it, but that is a pharmacy.
Yeah.
Following the instructions, I still missed the door.
Yep. You're supposed to miss it, though.
There's no way.
Good, because you're not supposed to find it. That's all. Honestly, I think that's how it's like been explained to me in the past. And I think it's like one of these unwritten rules that they kind of don't necessarily like put it in the open. That is usually where the drugs are.
Got you. And kind of to add to what you were saying, when I walked in there, it felt like a bee's nest, but things were, it was organized kind of chaos.
Yes.
Like everyone, it was busy.
Yeah.
Just everybody like hustling and bustling, but things were happening. And if you wait long enough, the same thing happens again.
Yep.
Like clockwork almost.
Yep.
It was really, really cool to see. I was in awe, and they were chuckling. Like somebody looked up and recognized that I was standing in the middle of this of dancing pharmacy techs and pharmacists.
Yeah.
And I was truly amazed. And they looked, one pharmacist looked up and chuckled and laughed at me. And she asked me, do you need help? I was like, I have this stuff. And she's like, I'll take care of it. And she took care of it. I was like, wow, this is amazing. I walked out saying, this is amazing. And they all like laughed and kept on doing their thing. And I thought that was really, really cool.
Yeah, no, it's a huge machine down there usually. So
tell me about your last 2 years at Tulane, Pulmonary and Critical Care.
So I've really enjoyed it. I think one of the things that stands out the most is, they closed down Tulane Medical Center, right? And that was like the last hospital in that area, those few blocks that remained after Katrina. And so
downtown. I
think it was a big thing for everybody, no matter how long you've been there. If you've been there like 2 years, if you've been there like 32 years, it was a big deal. It's just what it symbolized with that hospital closing and moving over to EJ. And just the move to EJ has also been, it's like, I don't know, moving into a college dorm and everyone's still getting used to each other, I guess. But it's been a very good eye-opening experience. Sometimes I'm like, have I learned anything? But yeah.
I find that you feel the most confident a year after you're done.
That would make sense.
Yeah.
That would make sense. And, I try to think back when I was finishing pharmacy school and I became like a pharmacist and I had that autonomy, how like scary it can be. It's exciting. It's scary. It's intimidating. And I just remember thinking like, okay, which one of my friends can I call if I have a question? Right. And I think this is probably something that happens too with like physicians when they gain autonomy. But I think it's just how humans gain autonomy. Like that's part of the process, right? Like when you're new to anything, you're going to phone a friend. You're going to find people that you feel confident saying, I just want to double check this. I just want to run this by you. I just want to blah, blah, blah. So I expect I'll be the same, when I'm at that point too.
What do you do outside of medicine?
So I do a good bit of running, and I have a good bit of family here. My dad's side is from the New Orleans area, so I spend a lot of time with my family down here. And then I run a good bit too when it's not 100 degrees outside. So what else? I have friends kind of that live around the United States. I haven't had a chance to travel internationally, but I've done a good bit of like kind of couch surfing throughout the United States in the past few years. I also am very fond of like animals. So during medical school, I started like fostering animals and working with a lot of like rescues and animal shelters and volunteering at animal shelters. And so I kind of carried over, ended up like fostering a dog, and then basically just a foster fail. And, so yeah, that's pretty much it. Kind of a low key life.
Running, are you, do you do marathons and all?
No, I kind of want to.
Have you ever?
No, I haven't. The problem with, I think, marathons is when you start training for the longer distances is finding the time to run like, 10 miles repeatedly, right? Because it just can take so long. I mean, on Saturday mornings, if I can, I like to run 5 or 6 miles, just kind of throughout New Orleans. But, if you go beyond that, you're going into like hours and hours. So it's tough to carve out that time. I did the Crescent City Classic this past year.
That counts.
Yeah, I guess.
For I personally, if I ran that, I think that I'd count that as.
Oh yeah, no, I can't. It's not that long though. It's only 10K, so it's not terrible.
Yeah.
And so that's kind of like, that was honestly like a regular Saturday morning for me.
Yeah.
But yeah, it was fun. This is like,
Do you do cats and dogs or just dogs?
Both. I currently just have a dog, but I've had cats and dogs both. So,
any preference?
It's tough. I honestly, for the longest time, I was like a cat person, and then I inherited some dogs from my mom, and then I kind of became a dog person. But I still really like cats. I just don't have any right now. So,
do you feel like, let's go back a little bit to I guess career. You mentioned your next step is transplant, lung transplant, sub-fellowship, really. Would you come back to New Orleans?
I may. It's definitely something that like I've thought about. I mean, this is always home. I have a home in the Bywater, and I don't think I would like ever sell that. That's always going to be kind of my center that I spin away from, I think.
Yeah.
But yeah, I might have to spend a couple of years away though, just to,
I have a mentor of mine. He was born here, or born in Lafayette, moved to New Orleans and did essentially all of his training here. And he always talks about, or at least he's told me, that he wished at some point he had moved away and came back. He loves New Orleans, but he values stepping away. It's good to have a different experience.
Yeah. I honestly, when I was in college, I was worried about that because, I grew up in really a small town in South Carolina. A lot of the people that I went to high school with are still there. And I found a lot of like happiness there, but I was worried I was going to get stuck in the same like city, same state, and not really experience more. But so after pharmacy school, I actually moved to California and did my pharmacy residency out there. And from there, I just thought it was fun to kind of move around. So I'm not really opposed to like moving around even now.
Right.
Yeah. I'm just like, I have family here. New Orleans is great, so I love it, but I would easily like move away.
Yeah.
So
if you couldn't be I guess the first question would have been, if you couldn't be a pharmacist, what would you be? It's be a doctor. If you couldn't be a doctor.
Smart. Honestly, I think I would probably do hair.
Really?
Yeah, I know. I don't know. I just like doing hair. You get to work with people. You hopefully get to make them happy when they leave.
Yeah.
It's a little creative. There's math and there's like strategy behind it. So.
Math in here?
Yeah. You have to figure out how much to cut, like the angles. There's angles you got to do.
Fair.
So, I mean, this cut was a lot of work. So,
wait, what's that called? There's someone that does hair. There's a name for that.
Cosmetologist.
Is it cosmetologist?
Yeah, I think so.
Is that? I always felt like that was just kind of anyone that does beauty.
Oh, all the music. Yeah, I don't know. So where I grew up, my high school actually had like a technical, like a trade school next to it. So people could graduate high school and have like a certification in like auto mechanics, and cosmetology was one of them. And so a lot of people, like a lot of women, went through cosmetology school that way through my high school. So I've always known it as like cosmetologist. That's just kind of like what I grew up with. And I always thought it would look like a really fun thing to do when I was in high school, but I was set on going to college. So,
do you do anybody else's hair other than yours now?
No, I don't know if any of my friends would actually like really trust me. They would be like, well, I don't know. You could start an IV on me, but I don't know if you could do my hair.
So for some people, the hair is much more important than almost anything else.
Yeah.
What do you feel? What's your future like beyond medicine?
So I think like beyond medicine, I guess honestly, when I get done with this part of like my life, like finish this training, even if I go for another year, beyond medicine, I think I'm very close to my family. So I'll remain close to my family. I'm really close to one of my brothers. He has like 2 boys. So a lot of times, like when I'm not doing medicine stuff, I'm with him and the boys. They're like,
and they're here.
They're actually outside of Atlanta. So yeah, they're not far away, but one of them just turned 3 and the other one's going to be a year old in August. So they're just so cute right now. But yeah, looking forward, I think spending more time with them, spending time with my family, really.
When you reflect, what are some challenges that you feel were crucial in making you the person you are today?
I think I'd have to say COVID,
Really?
I know. Well, so my mom, unfortunately, she was in a nursing home when COVID hit. And so she was the first person to get COVID in her nursing home. And she had already told us many a time before that she did not want to be intubated or anything like that. And so when COVID hit, unfortunately, she was the first one in her nursing home who passed away from it. And so that whole experience of going through it, she was the first COVID patient that I saw like face to face. And so from that moment, I think that just energized me for the challenge that was like the next 2 years, And I think had I not gone through that experience and like not felt it the way I did and not really understood like what everybody was going through, I don't think I would have, I would totally be a different person. I think I may have even like burned out, but I think it actually prevented me from burning out. I never got tired of COVID patients.
It sustained you.
Yeah, it did. It really did. There's something about it. Even when people would come in and be like, I'm not getting the vaccine, I'm not getting vaccinated. That never really even like wavered. It's like, it doesn't matter. You're a patient. You have COVID. I don't care if you have the vaccine. I don't care if you think the vaccine had like a microchip in it, whatever. Like, you're a sick person with COVID. So
that's COVID. The pandemic was such a weird time. And certainly hearing about that experience, there was a lot of fatigue. There was a lot of moral injury. We talk about that in medicine quite a bit. There's a lot of just internal fatigue from how overwhelming it was. And of course, the conversation around COVID was very, it didn't have, it almost felt like the world wasn't aware of what our patients were going through, and certainly not what we were going through.
Our world was so different than everybody else's world that wasn't there, right?
Exactly.
I think that's another thing too that made me think about it when we were, treating patients. It's like they just don't see what I see every day, and so it's not their fault. You can only tell people so many times. So
how does that affect the way you talk to your patients now with regards to some of the, because it can be challenging, right? So whenever you're having someone that's resistant. And I think healthy skepticism is good to be healthily skeptic.
Yeah.
The responsibility, we're not just physicians in that sense, but we also have a responsibility to be public educators, right?
Yeah.
So that's something that I'm learning as an attending, to be mindful and to be kind and to be empathetic to that we are foreign agents to a lot of our families and to a lot of our patients, where what we do isn't normal.
Yeah. Yeah.
When someone walks into your clinic, it's a regular day for me.
Exactly.
It's a very different day
very
for
big
them.
day for them sometimes. Yeah.
So trying to be mindful of that and to kind of break through that anxiety, the fear, and to deliver some sort of meaningful information that helps them make meaningful and good decisions.
Yeah.
How do you feel your experience through COVID has kind of impacted your interpersonal relationship with your patients?
I think often the thing you have to get to with patients or their families is like the motivation and what's motivating them to question things, to have skepticism, to have doubt or questions, or have even like friction or conflict with the healthcare team. So I think it's important to figure out what their motivations are. Because I think at the end of the day, we're all very vulnerable. We're all human. And so we're all the same. Sometimes I think we're more the same than we are different. It's just finding the common ground.
Yeah. I definitely agree with that. Often we are more the same than we are different. Do you think that at some point you would stop being a physician?
I've thought about this. I'm like, what is my retirement plan?
Yeah.
I don't know. I think I don't know if I would like quit. I'd probably do like the whole part-time thing I don't know, medical missions or something like that on the side. But I think eventually I probably would like retire, maybe like late 60s or something, just so that I could find like another version of myself or discover myself in a different way.
I ask because often there are physicians who being a physician is their identity.
Yeah.
And it's a passion you can't remove from who they are.
I think I'm at risk of that, but
really,
I think so. Because I enjoy work. I love going to work. I'll go to work and maybe I have an easy shift. I'll go find the hard things to do during the day and go do those things. So I'm definitely at risk of being that person that is always at work because they like work. At the same time, I think you have to find balance. Like you have to make yourself find balance sometimes. So yeah. And I think, for me, it would probably be healthier just for my own self to find a new way of inventing myself.
Yeah.
In my 60s or 70s. I don't know if I like the word retire.
That's fair.
Yeah.
Retirement it's not really more, it's
it's like reinventing or something. I don't know.
Yeah. There's gotta be a better way to say it.
I know.
What would you change about medical education, since you're coming from a similar, but like a cousin of how we were taught? What would you change about medical education that in such a way that you feel could certainly improve it for all students? So
I went to LSU Shreveport, and if there was a way that I could get more like minorities, more racial minorities into medical school, that would be great. I mean, I went to Shreveport, and I think in my class of 120 something people, there was like one African-American male. One. That was it. And, there was only like a handful of African-American women and a handful of anyone that wasn't like white. And so, but then like when you would go from the medical school, which was attached to the hospital, into the hospital, it was flipped, where you would see a very different like population. And so I feel like if there was a way that I could change medical education to allow for more minorities to come in, I think that would benefit everybody.
Why do you feel that's important?
Mainly because I think patients feel more comfortable when they see someone that's like them. I think it just adds more trust and a different connection. And it offers something that sometimes I can't offer to someone when they see someone that looks like them. Yeah.
Yeah, I'm inclined to agree. Again, I think I can't remember exactly. I went to a Caribbean medical school, so that dynamic is a little different. But from my perspective, certainly looking around at the people we serve, I'm in South Louisiana, just like you are. I'm in Houma, and it's a very diverse population down there, actually, in terms of patient population. And it's really cool to see how that population accepts, me as a physician. Because often I don't think of myself as a doctor outside of a hospital often. So even like when people introduce me outside of the hospital, I try to insist you don't say Dr. Ugo or Dr. Ezema, just Ugo is fine. But there's a way that it's done, down the bayou, if you will, that is very endearing. That it's part of the reason I love working there. It's like the patients there are so kind, they're so appreciative of the work you're doing. And as a Black man in medicine, I feel that is very rewarding, right? So to feel validated in your field, I think anyone would appreciate that.
Do you like wear your white coat at work? I'm trying to figure out what I'm going to do when I finally graduate.
I don't. I don't.
Do you wear like a jacket with your name on it though?
I don't.
Just walking around in scrubs with a name tag.
It's scrubs and your and my badge. I wear the white coat for shoots. If we have like a video shoot or I do like these little TV spots for the hospital, so I'll wear it for that. If I'm feeling particularly fancy one day, I might, I know exactly where it is. It's hanging on the back of my door.
Do you wear it for clinic?
No, I don't. I'll dress, I'll occasionally dress up, but clinic can be interlaced with procedures sometimes. So often I'm wearing scrubs, even for clinic. I don't. If I'm wearing a white coat, there's a very specific reason for it. And not 0% of it can be ego at times when I'm like, I'm feeling good today. I think I should wear a white coat, but it's usually scrubs or just a regular getup. Why do you ask?
No, I'm just trying to decide like what I'm going to wear when I eventually get there.
Yeah.
And I'm also trying to figure out if I'm going to introduce myself as like Dr. Ferrell, which sounds weird.
Versus
Dr. Stephanie.
What do you feel comfortable?
I don't know. I think honestly, even now I'm saying like Dr. Stephanie to people. I feel like it for some reason comes off softer and people just seem like, I know her first name. Oh, Dr. Stephanie. It just seems like it, I don't know. I think it pulls people in.
There is a difference between Dr. Ezema, which is my last name, and Dr. Ugo. I find, and I mean that in the way I say it. If I say Dr. Ezema, it sounds much more official, like I'm giving a talk or something. But my patients call me Dr. Ugo. I don't know if that makes sense.
It does.
My patients just call me Dr. Ugo. And although I don't know how much of that is because my name can be challenging, right? So they'll see my name and they have my full Ugo Chukwu. That's my full first name. They have it on the placard when you walk in. So how do you say your name? Whenever I meet someone for the first time, how do you say your name? I'm like, it's Ugo, the rest is silent or something like that. Or Dr. Ezema or Dr. E. They all naturally gravitate to Dr. Ugo. And it's kind of also grown on me. My mom is a doctor, and she is they call her Dr. Grace, which is her first name. And there's an attachment for me there. And she's also Dr. Ezema as well. But so when I hear Dr. Ezema, I think of my mom. When I hear Dr. Ugo, obviously I think of myself.
Yeah. Interesting.
So, there's a mental shift for me where I hear either one of those things. And I prefer Dr. Ugo in general. And on occasion, I might say Dr. Ezema or Dr. E. I find that I say Dr. E for like my older patients. As a Dr. E, you could go with that.
Yeah. No, I like I said, meeting people knowing people when they were fellows, residence fellows, and now they're, a lot of my friends are now attendings. And so I just kind of started paying attention more to how people are addressed when they're wearing white coats, when they're wearing a Patagonia, whatever it is. So that's why I was asking.
I guess I was going to ask, how do you feel about academic versus private practice? But transplant is almost exclusively academic.
Yeah, I think I fit better more in the academic space anyway. So I feel like that's probably where I would end up. I enjoy like teaching, and I don't mind stupid questions. I don't mind. I really don't. Like I enjoy that space better. So, regardless if I start lung transplant and I'm there for 10, 20 years, great. If I decide like, hey, I'm going to do something else, I'd still probably stay in academics. So I feel like it's just a better fit for me.
Were you able to do any sort of that educating? Because we're kind of in training. We're pseudo teachers, right? So medical school, right. You go into residency, interns teach medical students, second years teach, vice versa. Prior to that, did you have any sort of teaching experience?
No, not really. I've always kind of been interested in it into some way, just because that's how we all learn and we all share knowledge. And at some point, we're all the student, we're all the teacher. So I just have always kind of gravitated towards that. And certainly, like, as a pharmacist, if you've ever had to call a physician and tell them they made a mistake, you've got to figure out how you can like talk to that and get them to change their order to something more sensible. Yeah. I mean, it's just, there's a way of teaching people, even in mistakes like that. So yeah, it's, I don't know. I think that area, academics and teaching, is just something I naturally gravitated towards. Even next year. So you remember in conference, we do chest conference. There's someone that's like, right now we have like a scheduling chief and like an academics chief, conference chief. I'm the academics conference chief.
Oh, that's what I did.
Oh, see there? Yeah. So we're doing, different things this year. So hopefully. So I'll put you on the list. Are you on the email list?
I am on the email list. I still, my Tulane email still miraculous. It still works. But I understand they actually don't get rid of it ever.
Oh, really?
That's what I understand.
Oh, nice.
So I use it for like anything educational. So like up to date, something comes up like that, you can still use it. So I find that to be very helpful.
That is helpful.
Keep remember your password. That's the trick though. You gotta
remembering the password.
You have to remember your password. If you forget your password, it's a wrap.
You're done. You're done.
Because they're not going to help you.
No. IT's like, who is this?
What are you?
Who are you?
I'm curious to know, as a pharmacist, you mentioned whenever a doctor makes a mistake, because what the conversation I get whenever I put an order that's, a little bit,
Yeah. So there's always a way of saying things in a way that's nice. Everyone's got a different style. I usually like call people like, hey, I'm not saying it's wrong. I've just never seen it this way before. That's my favorite way of saying it. I'm not saying you're wrong. I'm just saying I've never seen it this way before. And I asked 3 other pharmacists and they've never seen it this way before either. So what we have seen is X, Y, and Z. So it depends on the person, right? There's been times when, can you imagine like the surgery residents sometimes are very busy. They're trying to take care of all the SICU and go into the operating room. And so sometimes it always felt like surgery benefited the most from like having a pharmacist around. And so sometimes I would just call them and be like, hey, can I have your name? I'm going to change a few things. You'll see them come up on your Epic. If you absolutely hate it, change it. Unless you want to talk about each one of these 20 things right now, you can totally do that. And they usually just like let me change things within reason, right? So there's different ways of kind of fixing mistakes,
Are you still keeping up with your pharmacy license?
So it's funny you should say that. So actually 5 years ago today was my last day as a pharmacist at Ochsner. Yeah, it was my last shift.
5 years ago today?
Yes. I started as an intern in 2019. So I remember June 13th was like my last day as a pharmacist. And it's June 13th, 2024. So I had my pharmacist license for a number of years after that. And then I let it go. I think 2022 or 23 was was my last year because I was just paying like money,
Yeah.
To the board of pharmacy every year to keep it up and do CME So I actually let it go. John Wynn did not, though. I think he still has his active. But I let Wynn. Yeah, I know, right? Again. I just did not want to keep putting money toward it. You can still go onto the board of pharmacy and look me up as a pharmacist. I'm there. It just says like inactive. Like I did it. I got the T-shirt. I was there, but I don't feel the need to give them $100 anymore every year.
My next question was if you would still moonlight as a pharmacist.
No, because I make more money doing that as a physician. So. I have to pay for the boards tomorrow, so like
it is time, isn't it? Woof.
It goes by fast.
Stephanie Ferrell.
Yes.
Thank you so much.
Yes, you're welcome. Thank you.
This is very kind of you. I appreciate you.
It was good.
All right. That was good, right? Yeah. It was fun. You can just leave. Thank you so much for watching this episode of The Last Zebra. As always, please don't forget to like, subscribe, share, and comment. We have new episodes coming out on Tuesday mornings on all of your podcast platforms and on YouTube. I'm looking forward to seeing you guys on the next one.